Governor Mike Parsons' announcement yesterday that restrictions on Missouri businesses will end Tuesday has left people with a lot of questions. KRCG 13's Mark Slavitt has gauged the local reaction.
Local officials will still have the authority to further regulate stay-at-home restrictions after the elimination of statewide restrictions this Tuesday. Governor Parsons says it is now up to Missourians to take personal responsibility for their own actions. Boone County Commissioner Janet Thompson says most counties will slowly phase out COVID-19 restrictions throughout the summer, even though state restrictions will completely disappear. Thompson says social distancing and limited seating at some restaurants will remain in place.
We met with the governor a week or so ago, and he was very mindful of the notion that Missouri is, yes, it's one state, but it's many counties. It's many communities within many counties, and it's not a one-size-fits-all.
Governor Parsons says at some point, government has to get out of the way and let people live their lives and regulate their own selves. Some Missourians worry about people who are careless.
It depends on what happens, I guess, as far as the virus. If it's really going around everywhere, then I probably just stay home.
I work from home. My company is still remote working, so I'm kind of going to follow their lead.
The owners of Columbia's La Siesta North restaurant say stay-at-home regulations are very confusing these days and want government officials to get on the same page.
We've been anxious to open like the entire place since we were allowed to do 25% and then went to 50. We're wondering, are we going to go to 60 or 75? Are we going to make it 100 yet? We don't know.
Friday marked opening day at Albert Oakland Family Aquatic Center. It's a day many have eagerly been waiting for.
I'm glad we got here early because if we didn't, we would have been still stuck in that line for a long time.
Although reopened for the first time this year, the pool is functioning under restrictions due to the city order related to COVID-19.
So the health department met us out here. We filled out paperwork saying what we would be doing in addition to what we currently do. And so we had that all approved, and then we went ahead and we went through retraining with all of our aquatic staff.
And it took several steps to get to the point of reopening.
For right now, we're doing 2 sessions. We have a session from 12 to 2 and another one from 2:30 to 4:30. During that 30-minute break, staff will come out. We're going to disinfect all the high traffic areas. The water itself, as long as it's chemically balanced and well maintained, then it is good, it is taken care of, and the virus will not affect that.
All pool amenities are available. However, visitors must now bring their own chairs for seating. On Mondays, the pool will be closed for deep cleaning. Overall, pool goers are adjusting well to the changes.
No, Governor Parsons says when it comes to reopening care facilities, they will be centralized and specific to each community.
After Governor Parsons announced Missouri will be lifting statewide restrictions, he then addressed what that means for care facilities and veterans' homes.
At this time, the Department of Health and Senior Services is working closely with the long-term care industry to issue guidance on safety and logistical reopening long-term care facilities,
making it clear these plans could be different in each community and individual facility.
We expect to publish these recommendations within the next few days.
Joyce Furnell, the Senior Vice President of Operations for Bristol Care, says they operate 63 residential care facilities across Missouri.
A lot will also fall on the local public health agencies in the county that facility is located in, what their guidance is going to be in conjunction with that of the Department of Health and Senior Services. So I think that every facility might be a little bit different based on their needs.
Furnell says they have ideas of procedures they hope to implement.
Limiting the number of visitors in and out. We would first get the priority people that need to be able to come and go. So we've already got a few things in mind.
But they really are just waiting to hear more about what reopening really could look like from the Department of Health and Senior Services in the coming days.